I'm Dr. Shivani Sehdev. I am the Medical Director of SCI Healthcare and I am a gynecologist and IVF and fertility specialist. Today I will be talking about something called as PCOS or PCOD. It is also called as polycystic ovarian syndrome or polycystic ovarian disease. So this is exactly the condition that I am talking about today. This is one of the most common hormonal disorders to affect women in our country in India. Almost 1 in 10 women suffer from PCOS. And what happens in this condition? In this condition, what happens is that the hormones, which are the male hormones, rise in the body of the woman. That leads to changes which include, if you've seen some women who have facial hair like a beard pattern or like a mustache, if you are losing hair from the top of your head, or if you have some kind of pimples or acne, these are all conditions which are associated with polycystic ovary. Along with this, the period becomes very irregular. So your cycles instead of 1 month can be 2 months, 3 months, or you may not get them at all. So if you suffer from something like that, please do not be anxious or do not worry, because there are a lot of treatments which are available for this. The treatments include medical treatment, it includes surgical treatment or other fertility treatments. So medical treatment point of view, the most important thing is try and lose some weight. Even if you lose just 2 or 3 kilos, you may consider that to be insignificant, but that is really quite important because that will help to overcome the problems that are associated with polycystic ovary. The second medication that you can use is called as hormonal pills. These are the birth control pills. What they do is they reduce the testosterone, androstenedione, or the male hormone in your body, and this helps to rectify the hormonal problems which are associated with polycystic ovaries. The other kind of medications are used by women who are trying to have a baby. They include clomiphene citrate, which is given for 5 days starting from the 2nd day of your period, and also a tablet called letrozole, which is also given for 5 days from the 2nd day of your period. And this has helped millions of women worldwide who suffer from this condition called PCOS to have a baby. On the other hand, if you are thin and if you have a high level of a hormone called LH and you've been trying to have a baby for over 3 years, or you are not responding to any tablets, you are not responding to injections even, then in that case you can opt for a surgical treatment. This surgical treatment is called as polycystic ovary drilling, where literally it is used to drill like a hole inside the ovary, and this puncture helps to correct the hormonal profile. You get better results with the IVF or with any just simple fertility treatment. You can get better response to the medication you are taking, and at the same time it can help you to get pregnant on your own even without having to use any other medication. The final treatment for polycystic ovary syndrome includes screening for diabetes, because remember, women with PCOS are at a higher risk of getting diabetes or high cholesterol. This is called as a metabolic syndrome. So make sure you check your blood sugar and your blood cholesterol levels regularly, especially if you are above the age of 40. Now after this, finally, the final solution for fertility, if you have taken medication, you have done surgery, nothing has responded, then the final solution is with IVF, and you will be happy to know the best success rates are in women with polycystic ovary. They can range up to as high as even 70% per cycle. So I wish you all the best in your journey through PCOS. If you have any queries, please do not hesitate to contact us. We are always happy to answer them. Thank you.